our hope is to see if we can, as I told you, with a heart attack, the muscle dies, and the hope is that we can rejuvenate the heart by introduction of the stem cells. And we have taken two approaches for patients with heart disease. One is using human embryonic stem cells, and human embryonic stem cells are pluripotent stem cells. They're true stem cells that can actually form an embryo. And these are from leftover embryos that were not used by IVF clinics in the late 1980s and early 1990s. And there was a significant limitation that was placed by George Bush during his presidency. Yeah, during his presidency, that that he put limitations on use of National Institute of Health funding for stem cell research. In fact, he only vetoed 12 bills during his 2 terms, compared to 44 bills that his father vetoed. And of those 12, 7 did not become laws, and of those 7, 4 of them were related to stem cell research. He was very, very adamant about putting limitation on stem cell research. However, things have changed over time. Also, there has been a lot of power that has been placed in the hands of local state governments. California Institute of Regenerative Medicine was formed approximately 10 years ago with $3 billion to fund stem cell research. And fortunately, we have benefited a lot from that, and also from the National Institute of Health at UCLA, where I have my research laboratory. And our approach is to use human embryonic stem cells, and we differentiate them. So we guide them to become heart cells in a petri dish. Once they become heart cell, they're committed to become heart cell, we isolate these cells and we deliver them into the heart. And we have shown, we have done these in large animals. After we induce a myocardial infarction, a heart attack, we know that these animals, large animals, pigs, they go into heart failure. And we have delivered these cells into the area of injury. And very interestingly, we have shown that the delivery of these cells can actually repopulate the lost, the damaged area. And the function of the heart partially returns. So this is going to be, in fact, it's going to be a way of, you can think of it, of a heart transplantation, but without an invasive procedure. Furthermore, we're trying to work on taking, rather than using embryonic stem cells, we take a skin sample. We just take a skin biopsy from a patient. We turn them back into stem cells. We differentiate them into the heart cells. We isolate those heart cells, and we want to put them back into the patient. So the cells come from the same patient, so no need for immunosuppressive agents. So this is one of the approaches that we have taken, and we have gone very far. And we're hoping over the next several years, over the next, hopefully next decade, we'll be able to start our clinical trials to pursue this in patients. The other approach that we have taken is, I told you the heart is made of muscles, but also it has structural cells that support the muscle. These are called fibroblasts, and they are everywhere in the body. And they participate in scar formation. So when there is a heart attack, these cells proliferate and they form a scar. What we have done, we have identified several factors that can stop these fibroblasts from forming scars, and we have actually turned them. We've called them reprogramming. We've turned them back into muscle cells. So the bad cells in the heart that form tissue, that form scar, we have guided them to go into muscle formation. So the scar actually becomes muscle. And we have shown that happen not only in petri dish, we have shown that to happen also in the heart itself. It's just the delivery of certain factors into the heart in the area at risk. And these cells that are proliferating, that they're dividing, that they're expanding to form a scar, all of a sudden, they change their fate. They change their fate and become muscle cells. And they become cardiac cells, and they start contracting. And the heart that wasn't contracting anymore starts contracting very vigorously. And we have seen it in large animals, that these large animals that go into heart failure just by introduction of these factors, they actually form new muscle. And this is for the first time that the heart is actually rejuvenating itself. So there are a lot of exciting things that are on the horizon, and I actually find myself very lucky to have I always tell my wife that the most important thing is, just in life, the most important thing is to look forward to go to work every day and to look forward to coming back home every day, to come to a happy family, happy wife, a wonderful, wonderful home, and also enjoying my job that every day I look forward to it. And I've been blessed to be in an institution that has been very supportive, and also we believe that we have accomplished a lot, and we truly think that the way we have taken this research, we do think that within the next decade we'll take it into clinical trials, and I'm hoping that perhaps for the next generation to come, this will be an option. I wanted to just finish this with, as Iranians, we're very, we should be very proud of our history, that we've had great physicians in our history. You think about, the father of medicine, some people think, is Aristotle, and then later on Galen in the Roman Empire developed the entire anatomy or the scheme of the human body. But it was Avicenna or Ibn Sina who actually perfected the medicine. His book, The Canon of Medicine, or Qanun, is still being taught in Yale as part of history of medicine. To this day, the book that was written almost 1,000 years ago, yeah, it was 1,000 years ago that Avicenna wrote this book. It's still being taught at Yale University. And what he did was, for the first time, although religious, the religion at that time would forbid people from post-mortem examination, he was so far that his diagnostic capabilities were fantastic. However, they had no pathology correlation because he didn't have any post-mortem to compare. However, during his last years of life, he started doing autopsy on patients. He actually found how the heart actually works. And in his book, he has written many pages just looking at the pulse of a patient. And his diagnostic capabilities are fantastic. He wrote more than 50 pages on just how you can diagnose heart disease based on the pulse. Not only he discovered the regular pulse versus irregular pulse, what amazes me in his book, he also talks about the regularly irregular pulse that we now understand is when you have an irregular pulse that actually repeats itself regularly, and this is a specific disease in heart disease. However, what I wanted to get at was Avicenna, when he went to the court, he was favored because he treated the king for some infection. What he wanted for reward was access to the library and for the king to allow him to put together a school for education and research. He dedicated his life to research, and that's why he continues to be one of the living physicians. No matter how long it passes since his death, he continues to be one of the leading physicians and experts in cardiology. Sir William Osler, who was at Hopkins where I trained, he refers to the Canon of Medicine, or Qanun, as the ultimate book of medicine. And we're very proud to have these in our history, and we should be very proud to also have, I look around and I see a lot of very achieved Iranians, whether it's in medicine or in engineering, in business, everywhere we look around, we should be very proud. So I hope this was a brief introduction of cardiology, and if you have any questions or if I can be of any help, please don't hesitate to talk to me. Thank you very much.
Amazing. Exceed our expectation.
Thank you.
I think he has a question for Dr. Ardehali.
Hi, Shungan.
This embryonic cell is in a large animal, taken from the animal and then treated animal, or it came from human? When we inject the inject directly into the damaged heart. Now, when the muscle grows, how does the muscle will populate in terms of orientation of the cells and also connection of the cells and the host cells?
Yeah.
I think the answer is
Okay, so the first question, these are actually excellent questions. First question is, we have done both. We have taken, for example, in our pigs, we have made induced pluripotent stem cells from the pigs. So we took skin biopsies from the pigs and we made them into pluripotent stem cells, and we differentiate them into heart cells and we transplant it into the pigs. So it comes from the same pig. We also have done from human, and which takes me into answering your second question. The electrical connection between the transplanted cells and the host myocardium continues to be the biggest challenge. That perhaps is the biggest challenge of stem cell therapy for heart disease. Because you think about it, we're introducing cells into the heart, and these cells may decide to work independently, and they may become a focus of arrhythmia. So we have to make sure that they're oriented in the right way, and they make appropriate electrical connections with their surrounding neighbors. And we have seen that if interspecies differences would not allow electromechanical connection. So there is no synchrony between the transplanted cells and the host cardiomyocytes or the heart cells. However, when we take it from the same species and transplant it, depending on the stage of transplantation, if we wait too long that these cells mature, then we transplant them, they do cause arrhythmias. But if you take them early on, that they have the ability to differentiate after they were transplanted, we have seen that these cells actually integrate and synchronously contract with the surrounding cells.
And then, so the new cells, have some idea when to stop regrowing, because it could cause a mass effect as a tumor.
Right. Yeah, so fortunately, the heart cells don't have the ability to undergo division. They're terminally differentiated. So basically, the number of cells that we transplant is going to be the number of cells that would be required. So just to give you an idea, the heart has about 5 billion cardiomyocytes, or the muscle cells. In the case of a severe heart attack, when there is proximal occlusion of the anterior or the front of the heart, about 1 billion cells die. So in order to address that, the number of cells that need to be transplanted, they're extraordinary.
Has been ever research about why the heart cell hasn't got any cancer?
So the question is, has there been any research as to why the heart doesn't get any cancer? So the heart, there's only one type of heart cancer as we know, and it's called myxoma, and this is a very benign cancer of the atrium. It's like a ball that just forms in the heart, and sometimes we diagnose it based on a murmur, and we just go in and take it out. And only a few cancers metastasize to the heart. Mostly they are muscle cells, like sarcomas, leiomyosarcomas, myomas, and skin cancer. These are the majority of the cancers that metastasize to the heart. The reason that the heart is not a primary cause of cancer is, as I said, heart cells don't undergo division. They're terminally differentiated. Even if they undergo division, the rate is extremely low. We have shown that about less than 0.5% of the heart cells undergo division. Compare that to the intestine. The intestine, almost every 10 to 20 days, the entire lining is changed. So the rate of division, the rate of renewal of the cell, the higher the amount of cell division, the higher the chance of cancer formation because of the abnormalities that may occur in the DNA and the damage that could be caused. Bunny.
Approximately, how long does it take for you to take the skin sample and convert it to a stem cell and then reintroduce that to the body? How long is that process?
Yeah, so that's one of the challenges as well, because it takes approximately 2.5 weeks from the time of the skin biopsy to making the stem cells, and another 6 to 7 days to differentiate them and make heart cells. So altogether, it's about a month. However, the other approach that we have taken by directly reprogramming those bad cells, the fibroblasts that form scar, that can happen very, very quickly in the body. So we can introduce those factors, and in the body, the cells can convert to a contracting cardiomyocytes or heart cell.
So do you see more research going in that direction, or do you see more research going in the stem cell direction?
Yeah. So I personally don't think we should put all our eggs in one basket. I think the more approaches are thought out, and the more we invest in this field, the better. Unfortunately, over the past 20 years, the whole field of stem cell, just because it sounds very sexy, it just took off. And a lot of people that were not experts in this